This year we're at the Science Specialist University, Imperial College London, and we're here to focus on the technical revolution defining our era. Artificial intelligence. I'm joined by a panel of 3 world leaders in the field and a large enthusiastic audience in Imperial's Great Hall. Already a computer can defeat the world's greatest player at our most complex strategy game. The first movie, written entirely by AI, has just been released, and AI may have discovered our first antibiotic in 3 decades. Together with our partners Royal Commission 1851, we've brought together 3 engineers at the cutting edge of this field to discuss their work and what it means for us humans. Paolo Pirjonian is Armenian, but he was born in Iran and started his career working on Mars rovers for NASA. He's now founder and CEO of Embodied, which is a company that builds emotionally intelligent robots to help with child development. David Silver is from the UK, where he's principal research scientist at the AI research lab Google DeepMind. He led the team that used AI to defeat the world's best player at the complicated strategy game Go. And he's working on artificial general intelligence. Regina Barzilai is Israeli-American and a distinguished professor for AI and health at MIT in the US. She created a major breakthrough in detecting early-stage breast cancer and also led the team that used AI to discover what is hoped to be a brand new antibiotic. So please do join me in welcoming them all. Regina, let's start with you. So what is it that made you shift your work to oncology? Sadly, you were in the perfect position to do that, weren't you?
Yeah, so actually I started my work at MIT in 2003 as a faculty, and I was working on natural language processing and AI. And in 2014, I was diagnosed with breast cancer, and I was treated in one of the best hospitals in the United States, Massachusetts General Hospital. And what I discovered going through the treatment, that there was really no AI or not even basic information technology as part of the treatment, neither the diagnostics, nor the treatment, nor the post-treatment. And after I was treated, I just was totally confused as to what I want to do, because it was the first time I realized that my life is finite. And I've seen a lot of very sick people there surrounding me. And I was thinking, what can I do? And MGH, this hospital, and MIT are just one subway stop away. They're separated by a bridge. I'm thinking, how come we have all this great technology at MIT, but none of it is actually coming to the hospitals and helping patients? So after I finished my treatment, I still didn't have my hair. I started kind of going from doctor to doctor, asking them, how I can bring AI. I will do it for free. I'm a professor. So there were not many takers, but eventually we found somebody who, it was a doctor called Connie Lehman, who had the idea that we can apply AI to do early detection of cancer.
Thank you, Regina. David, you came to AI via the games industry and you did a PhD in reinforcement learning. What is reinforcement learning and how did you use it in those early days?
Yeah, so I guess I started out in the games industry before I went back to academia, and I was working on building computer games. And as a big part of building computer games is building the AI for those games that kind of makes all of the characters move around. And I found myself being fundamentally disappointed by the methods that were being used in those games, and it felt like what I really wanted to do was build something that had real AI in it. I discovered this idea of reinforcement learning, which is basically a method very much like those that animals and humans use, where the system is able to learn for itself from experience, from trial and error, from trying things out and seeing what works and what doesn't.
So is it sort of like when we learn to not touch fire because at some point we try it and it really hurts, and we learn don't do that in the future because the consequences aren't appealing? Is it sort of like how humans learn reinforcement learning?
Yes, it's a lot like that. So in fact, humans are believed to have a major part of the brain which is devoted to providing a signal, giving feedback that makes the brain actually learn to do more of the good things and less of the bad things. And so actually that's inspired a lot of work in machine learning to make machines have that same capability.
But a machine doesn't feel heat or isn't rewarded by a cookie. How can you reward a machine?
Yeah, so for a machine, it's just a number.
What?
You give it, so you give it a positive number if it's done something good, and a negative number if it's done something bad. And at the end of the day, everything stems from that one single number. So this one single number, which we call the reward, contains enormous power because it's the signal that drives everything.
Paolo, you said your experiences of feeling alienated in foreign countries made you want to create an imaginary friend, and I'm sure much of our audience can relate to having an imaginary friend, but for most of us, they stay imaginary. How did you go about making a real one?
So, unfortunately, there's a lot of people in need of companionship or therapy, and there's a massive gap of labor force that can provide this. As an example, to use numbers from the US, we know the prevalence of things such as autism is growing rapidly. 10 years ago, it was 1 out of about 200 kids. Today, it's 1 out of about 30 kids. So the experiences I had, which was leaving my family at a very young age, living abroad in a society that's amazing. I mean, Danes are amazing people, but yet you're different, so you're not going to be embraced. So this is not too dissimilar from a child on the autism spectrum that has a hard time expressing themselves or reading emotions from other people. And that was the genesis of creating a robot companion that understands human emotions, can create a deep relationship with a child, and then help them exercise and practice these social skills such as eye contact, turn-taking, joint attention, and so on, so that the child has a chance of being successful in their society.
Thank you.